Hi, I'm Gemma Norris from Remedial Therapy Clinic, and today I would like to go through with you the benefits of diaphragmatic breathing. So, if I sort of say to you, breathing is important, it would be quite an obvious statement, but it's very important at how we breathe, and it's vital to our mind, body, and our emotions. Many of my clients, my lovely clients that come and see me, for all sorts of really various ailments, be it headaches, migraines, digestion issues like IBS, indigestion, and anxiety and depression and chronic pain. So quite a real varied element of different problems. And once I've gone through the history of what's gone on with their bodies and their life and accidents, etc., I then do a simple question of just take a deep breath for me. And I watch them take a deep breath. And most of the time, pretty much majority really, tend to breathe from the upper respiratory tract. So this coming up with the shoulders up towards the knees, the ears. And what that does isn't how we should breathe in a long-term fashion. It's more there for if we need to take that extra deep breath when we're going through a more sort of strenuous type of exercise or in fight-flight mode. So really, what I'd like to do today is kind of show you how we should breathe properly and what that benefit is to you for your mind and your body. So if you now just take a nice deep breath, and if you start finding yourself your shoulders are coming up, then this video would hopefully be really helpful for you. If you find yourself that you've got this lovely, big, beautiful Buddha belly going on with your nice breath in, then you're on it already, so you're cool. Just keep up the good work. So, reason why is breathing properly good for us. As if you take it back to a little baby, just imagine a little baby lying on their backs and their tummies are going up and down, a nice little rhythm. You won't see their chest coming up and down like so tightness. So that's how we would have breathed when we first were born, but over time we tend to tighten our lower abdominal area, our core area, and due to wanting that flat stomach, which I for one, 2 children, tend to need to hold in a little bit more now. And then we've got exercise, feel like you always have to hold that core in tight. We're in pain, we hold ourselves tight as well. And emotional issues and trauma, like surgical sort of surgery and C-sections, all these things, it starts becoming like a scar tissue that forms within our abdominal area. And what that does is causes restrictions of movement. And for us to breathe correctly using our diaphragm, which is like the key sort of respiratory muscle, for it to contract, it needs to come downwards towards the pelvis, so lowering down the stomach and through the digestion system. And for it to do that, everything needs to be moved and be able to move and be fluid. But due to these tensions that we've got within the lower abdominal area, we tend to pretty much tighten sort of like below the rib cage here, which is where the esophagus and the diaphragm sits just under the ribs there, under the breastbone. And rather than that lowering breath coming down, we tend to come upwards because the diaphragm hasn't got anywhere to go. So we're not using the diaphragm to its full extent. So we end up having to use accessory respiratory muscles. The key of those muscles are sternocleidomastoideus, or SCM for short, and the pec minor, which sits underneath the pec major, with the serratus anterior as well, and a few of the other sort of muscles as well. But those ones are sort of the key respiratory muscles. So over time, you'll find by not using the abdominal and using the diaphragm correctly, we tend to overuse these muscles. So these become hypertonic, which you call very tight and shortened. So the pec minor brings your shoulders in, protracts them, comes downwards as well, which is then drawing my neck downwards and my face downwards, as well as this muscle being tight, which can be quite prominent with some people. And now my eye line is being drawn down towards the floor. So as humans, we need to see the horizon. So we then have to tilt our head back, depending on how tight we are at the front, depends on how much this shortening and tightness and restrictions goes on the back of the neck. And that causes the back of the neck, the occipital area, to become really quite tight, and that impinges the blood flow up into our brain, into our scalp, and the fascia, which is like the connective tissue, becomes very short and dehydrated and restricted. So there isn't much blood flow coming up into the mind. So we get that tension, headaches, migraines, and you'll find often with the sternocleidomastoidis that muscle gives you that kind of key kind of question mark sort of pain that comes up into the eye. So it's really key of how we're breathing can cause us to come into more pain. And way this position is also putting us into slightly a stressed position. So we might not be stressed in our mind, but our body's stressed, which then communicates to our mind we're stressed. So there's this constant sort of negative cycle going between mind and body. And whilst you're then putting yourself in that stressed sort of psychologically, the body sits more within what we call the sympathetic nervous system, which is our fight-flight mode, which I class as our red mode, which is, if you're running away from the big cat, as it were, or sort of having to chase after our food, which we don't often tend to be in that mode very often, but we tend to sit in what I class as the amber mode, which is kind of the transition between sort of the red coming up into that fight-flight mode, and it kind of puts us on alert. Sort of slight anxious element of our bodies. So the body never really comes down from the sympathetic nervous system state, which what we want it to do is to go into what we class the parasympathetic nervous system state, which is the sort of rest, digest system, which is what I class as when we're in green, which is very much our in the moment and relaxing and in the moment now and very chilled and relaxed, which is a lovely place to be. But I do find a lot of people are sitting with different stresses of life tend to be within that amber state. So sitting in that state of mind and body, it's overusing in the sympathetic system, which over time what it has to do is it slows down the digestive system, because that's the last thing that our body needs when we're trying to run away from something or fight something. We don't need to digest our food. We need the energy to our muscles and our system for us to work and to be able to actually run away from any danger. So what's going on then, if you're in this kind of heightened sort of state of anxious or stressness, the body will continuously look to subdue the digestion system, and it doesn't actually function in its optimum. And that can lead to many different symptoms which I see, which can be IBS, bloating, plays way to food intolerances, and that then can come along to anxiety, depression, and continued on a chronic state can actually become an autoimmune diseases as well, because we've got leaky gut. So I could go on about all the different aspects here, but I wanted to really sort of key for me today was to kind of just highlight to you how important it is to breathe properly and through our diaphragm, and it just helps our mind and our body, and it just brings us down and calms us down. So, and it's something that you can do on a daily basis that can help you if you're in pain or suffering with any of these symptoms that I've talked about. And it's just something you can involve into your day-to-day basis to just come out of pain, because we don't need to be in pain. We shouldn't be in pain, and there's ways out of it. We just have to find that key to release you from that pain. So hopefully that's explained a little bit the logic behind what I'm about to, how I'm talking about it. Because I often find when I mention to someone to breathe through your stomach, they look at me like I'm kind of crazy. So when you're ready, what I'd like you to do is just lie down on the floor, somewhere comfortable, just relax, get head supported, and just be very sort of calm, and just sort of come into your breathing, into your body. And we need one hand on your chest and one hand on your abdominal area. And what we want to do, this hand on your chest, we don't really want that to move too much. This needs to be nice and sort of kind of still. Your hand on your stomach, on the other hand, we want that coming up as high as we can possibly make it. So we're going to breathe in for your nose and then out for your mouth through pursed lips. So we take that in breath, and you can imagine your stomach's got a silver thread on it, like an umbilical, sort of kind of pulling it up. So you're breathing in and you're really allowing your stomach to come out. So what you probably have to do is push your stomach out more initially, which will feel completely random. And this isn't something that you do breathing on a day-to-day basis. This is more to do with neurologically retraining the mind and the body in terms of how to breathe properly. So we're hoping to emphasize the neurons to say this is where we breathe from. So that's why we're making these big movements. And eventually, after lots of practice and time, that you'll just start automatically breathing through your abdominal area. Okay, so going back, so we're breathing in for our nose, out for our mouth, and we're just imagining our stomach really growing as we breathe in. So just let everything go. Just let it go. Just bring out this big Buddha belly for me. And then as you breathe out, you just breathe in slowly through pursed lips, just tucking in those pelvic floors. Just if you're trying to stop yourself from going to the toilet, just hold that in slightly. It's not too vicious, just holding it in. And then let them go. Let them drop. Everything just goes flat. And then you breathe in again. So just repeating this cycle in and out. And eventually you just kind of see if you can push it a little bit more. So imagine like a lift going higher up or then lower down. And just start really feeling your breath, but making sure that it's gentle. You know, imagine that the waves coming in slowly. So it's nice, slow, up and down web. And just enjoy that. And if you can do these sort of exercises, diaphragmatic breathing, for 5-10 minutes a day, morning and night, will be really good for you. And whenever you get that time where you're maybe sitting in the car a little bit, just try and really focus. Okay, breathe into my stomach, or wherever you are where you can just think, I can let my belly out here, I'm just going to let it go. Great, do that. And if you're ladies as well, take the bra off, take all those restrictions, because that can really kind of cut into the abdominal area, the diaphragm area, just because that will just sort of cause even more tension. So just get your baggy pants on, take the bra off, just really let everything hang out when you can, and really just breathe into your abdominal area, and you feel amazing. And you'll probably find slightly lightheaded. That's totally normal, because you're bringing more oxygen into the body, and you're also kicking into the parasympathetic nervous system, which is when the body starts to heal itself. So you just might feel tired, but ultimately you just want that beautiful relaxation. And equally, you might also find emotions and thoughts coming through. Don't fight them, just let them come. You can imagine them like clouds passing by, if that's it, and just keep letting the body flow, and this will be great. And it's an element of meditation as well. So I could go on, I shan't, but hopefully this has been interesting to you, and hopefully it's something that you can incorporate into your day-to-day basis, and just basically become more pain-free and more relaxed in your body. But if you wish that, if you would like to contact me at all and to discuss in any more detail, please do not hesitate to do that. I love this, as you can imagine. So my details are on my Facebook page, so that's Remedial Therapy Clinic, or www.remedialtherapyclinic.co.uk. Again, I hope this has been of help for you, and happy breathing. Take care. Bye.